This video will illustrate for you a step-by-step process about how to administer your medication through your IV catheter using the push method. It is called the push method because you will be pushing your medication slowly from a pre-filled syringe of medication. Please note, the products that are seen in this video may differ slightly in terms of color or size than what you receive at home. Your clinician or home health agency nurse will demonstrate all of your supplies during your first few visits. If you ever have any questions regarding this video or your supplies, contact your pharmacy. The number is located in your patient packet that you received with your first delivery. Before you begin, remember to remove your medication syringe from the refrigerator at least an hour before your medication is due. It is a good practice to set a reminder for you to do this step about an hour prior to your scheduled dose. Place your medication syringe on the sash mat that you should have received in your first delivery box, or you can put this syringe on a hard surface that you have thoroughly cleaned. Step 1. Washing your hands. To start with, you will need to wash your hands thoroughly for at least 20 seconds using soap and water or a disinfecting alcohol-based hand sanitizer if you don't have access to soap and water. When finished washing your hands, you will dry them with either a paper towel or a clean hand towel that is used only for this one time. Use the towel to turn off the faucet. Step 2. Your medication. You have already taken your medication syringe out of the refrigerator and have either placed this on a clean surface or on the sash mat. If you are using a sash mat, it will be your guide during this procedure. You will need to clean this mat after each use with an alcohol-based wipe or solution or with soap and water, and you will need to store in a clean, dry place for the next use. Do not put this medication in the microwave, nor run warm water over the syringe to hurry up the process. Review the label on your medication syringe. Make sure it has your name, the correct name of the drug, and the dose. Look at the expiration date. The medication should be clear and consistent in color and free of any visible particles. If any of these cause you concern, do not infuse and notify your pharmacy. Step 3. Your supplies. Now, gather your other supplies, which include 2 pre-filled saline syringes, a heparin syringe, if this has been ordered, and 4 or 5 antiseptic pads. Take the wrappers off the syringes and place them back on the sash mat or clean surface. After you've gathered all the supplies, it's now time to sanitize your hands again. Step 4. Preparing your syringes. Now you will prepare the syringes. Each pre-filled saline and heparin, if you're using it, syringe has a cap on the end. To make it easier for you, the saline syringes have a white cap on the end, and the heparin syringes have either a blue or yellow cap. They're also clearly labeled on the side of the syringe. Hold the syringe upright. Loosen the cap on the syringe, but do not remove it. And gently pull back the plunger of the syringe to put in a small amount of air. And then push the plunger until a small amount of solution comes out of the syringe. Now you can retighten the cap. This removes any air that might be left in the syringe. You now will repeat this with all saline and heparin syringes, and then again place them back on the sash mat or your clean hard surface. Step 5. Flushing your catheter. You are now ready to flush your catheter. SASH means saline, administration of medication, saline, and heparin. And we believe it is easy to remember the steps by using these letters. If there is a swab cap on your injection cap, remove it and throw it away. Then open an antiseptic pad and clean the end of your injection cap vigorously for at least 15 seconds. Do not ever remove the injection cap. If for some reason the cap is removed or comes off, be sure to clamp your catheter and call your pharmacy right away. Now remove the cap from the end of the first saline syringe and attach it to your injection cap by pushing and twisting until it is firmly in place. The end of this syringe is sterile, so if you accidentally touch it with your hands or put it on a surface, then it needs to be thrown away, and you will need to get a new syringe. Keeping the syringe end sterile is very important to help keep you from getting an infection from your IV catheter. Unclamp your catheter. Push the plunger on the saline syringe slowly, or you can use the pulse method to flush the catheter. To use the pulse method, push the plunger, pause, and then push and pause again until the saline syringe is empty. Do not force the flush. If you meet resistance, contact your pharmacy before proceeding. After you complete this flush, remove the syringe from the injection cap and throw it away as your nurse has instructed you to do. Step 6, administer medication. You are now ready to administer your medication. Open another antiseptic pad and again, clean the injection cap vigorously for 15 seconds. The medication syringe is filled by a pharmacist, and there is no need to remove any airlock or air bubble like you did with the saline and heparin syringes. Attach this syringe to your injection cap and push and twist it until it is firmly in place. If your hands touch the end of this syringe, or if it touches any other surface, clean the end of the syringe vigorously for at least 15 seconds with an antiseptic pad. Be sure that your IV catheter clamp is still open, and slowly push the plunger to administer the medication at the rate according to what is listed on your label. When the syringe is empty, remove it and discard as you have been instructed by your nurse. Step 7. Flush catheter again with saline and heparin. You will now flush your catheter with the next saline syringe, being sure to clean the injection cap with an antiseptic wipe for 15 seconds. Discard the syringe when this syringe is empty. If you have been instructed to do so, you will now repeat the flush with the heparin syringe. Again, cleaning the injection cap with an antiseptic wipe for 15 seconds. The heparin syringe has 5 cc's of solution. The label on this syringe will tell you how many cc's to flush. If you used the pulse method when flushing with saline, we recommend that you do not use this method with the heparin, and just slowly push the prescribed amount of heparin into your IV catheter. Clamp your IV catheter before removing this heparin syringe, and then throw the syringe away. You can now put on a new swab cap on the end of your injection cap. Now is a good idea to rewash your hands. Congratulations! You are now finished with your IV push medication. If you have more than one lumen or port on your catheter, there are more steps to take to be sure that you keep all these lumens open and ready for use. To learn more about that process, please watch the video that is titled Catheter Care. Your pharmacy is available to help any time of day, any day of the week. Do not hesitate to call us with questions or concerns. This contact information is in your folder. You will also find resources on our website available to you at www.emeritaiv.com. We look forward to the opportunity to serve you.